Hello, my name is Kimberly, and I am the Caregiver Education Coordinator at the Alzheimer Society. The Alzheimer Society knows that caring for someone living with dementia can be challenging. We know that this is even more challenging with social distancing as we try to prevent the spread of COVID-19. This video series will help care partners of people living with dementia to keep themselves and the person they are supporting safe and engaged during social isolation. Perhaps you are still working, caring for a family, and having to offer support to someone living with dementia. You may have increased financial costs as many caregivers have been forced to leave work to protect the well-being of the person they are caring for. We understand that your situation may not be easy, and we hope that some of the suggestions and activities in this video, along with others in this series, will support you. In this video series, we will explore tips and safety measures during COVID-19, ways to keep the person living with dementia engaged with meaningful activities, supportive communication, and how to take care of yourself and some of the available supports. Please be sure to watch each video in this series to best support yourself and the person living with dementia that you are caring for. In this video, we will look at self-care, including some of the resources that are available to support you at this time. It can be easy to forget about your own needs when you're caring for someone else, but it is incredibly important. Imagine yourself as a pitcher of water, and all of these glasses are your responsibilities. If you are not filled up, how can you possibly fill the glasses? According to a PBS article by Leah Eskenazi of the Family Caregiver Alliance, spouses between the ages of 66 and 96 who provide care are at a higher risk for mental and emotional strain, and they have a 63% higher risk of dying than people the same age who are not caregivers. And for adult children caregivers who also juggle work, kids, and relationships, there is an increased risk for depression, impaired immune system, and likelihood for developing one or more chronic health conditions such as hypertension, high blood pressure, and high cholesterol. Therefore, it is very important as a caregiver to engage in some form of self-care. Self-care means doing things that are enjoyable for you and will work for your situation. Here are some ideas that you can try. Going for a walk, even a short walk around the block, may be enough to give you a break and clear your head. Baking or cooking, home exercises, either on your own or following an online program. Healthy eating is a great way to feel your best. Drinking plenty of water, limiting social media, writing in a journal, doing expressive art such as painting, drawing, coloring, clay making, or Lego. Taking some time for solo activities like puzzles, crosswords, and word searches. Listening to your favorite music, listening to a TED Talk or a podcast. Keeping a good sleep routine by having a bedtime routine where you wake up and go to sleep at the same time every day. It really is about choosing what works best for you. There are also some breathing exercises that are particularly effective in managing stress. Let's look at a couple of examples. Here we have the 4-7-8 measured breathing, where you would take a deep breath slowly through your nose and count to 4 as you breathe in. Hold your breath and count to 7. And then exhale through your mouth and count to 8 as you exhale. We also have belly breathing. So here you would sit or lie down in a comfortable position. Put one hand on your belly below your ribs and the other hand on your chest. Take a deep breath slowly through your nose and inflate your belly. Your chest should not move, only your belly. Slowly breathe out through your mouth with pursed lips, like you're whistling, and deflate your belly as you blow all the air out. and you can repeat both of these exercises 4 times. And lastly, reach out for support. Remember that you are not alone and there are others who can support you. Connect with family and friends with a video call regularly or a phone call. The Alzheimer Society is still here to support you as well. The Alzheimer Society offers education, information, and support to people living with dementia, family members, healthcare professionals, and the general public. With restrictions related to COVID-19, our staff continue to offer services such as support, education, and recreation programs by phone or online. Some limited services may be available in person as well. You can find materials in English, French, Punjabi, and Chinese at the website findingyourwayontario.ca. You may also want to consider contacting telehealth at 1-866-797-0000 if you are worried about any symptoms you may have related to COVID-19 or otherwise. The Distress and Crisis Center provides support if you are in distress or need emotional support. You can find your local distress center at their website, dcontario.org. Here are some resources that were used in creating this portion of the presentation. The Alzheimer Society is here to support you during this time. Contact your local society for more information and services. And don't forget to watch the other videos in this series to support you and the person you are caring for with dementia.